Okay, hello everyone, and welcome to today's Q&A. My name is Kranti Kulkarni, and I'm going to be your moderator for the session. It gives me great pleasure to introduce Dr. Anne Bagchi and Dr. Mike Braitsch. Dr. Anne Bagchi is a family nurse practitioner and an assistant professor at Rutgers University. Dr. Bagchi's research has focused on improving screening for rare and stigmatized health conditions within primary care settings. Her work in the area of MSA seeks to improve awareness of MSA among registered nurses and nurse practitioners. She has served as a healthcare proxy for her mother, who was diagnosed with MSA in 2015. Dr. Michael Braitsch is a licensed doctor of physical therapy who specializes in helping people utilize principles of neuroplasticity for healthy aging. He's also a lifelong martial artist, a former amateur fighter, a published researcher, and a contributing faculty member at the University of St. Augustine School of Health Sciences in Dallas, Texas. He's also an advocate and presenter for Davis Phinney Foundation and Parkinson Foundation. Thank you both for joining us today.
Thank you for having me.
Dr. Anne, the first question is for you. Does a nutritionist or a dietitian play a role?
Yeah, of course. Patients with MSA, especially as the disease progresses, start to develop difficulty swallowing. So nutrition can be a really critical part of maintaining their wellness particularly as the disease progresses. So I realized that was something that was left out of the slide deck, but of course there is an important role to play. And the slide deck necessarily, the team suggested wasn't necessarily comprehensive, but certainly there is a role for nutrition. As patients, the needs for their diet, the types of foods that they're able to tolerate, these things can change over time. And so, this is one of the roles that a nutritionist can play.
I guess, even the texture of the food that they're gonna consume, even that's gonna affect and play a role in your diet. Okay, there is another question for you. Is a non-diabetic hypoglycemia a symptom of MSA?
So I don't know as much about that. I mean, I think there can be other symptoms that occur that are not as common, maybe not diagnostic for MSA. I know there is a study recruiting right now looking at brain insulin resistance, so reduced insulin signaling in the brain, that they found in post-mortem brain tissue of patients with MSA. So I think there is a study recruiting right now to kind of look at that and what kind of role that might play. But
so there is a study. Okay.
Yeah, there may be more than that, but I know that there is one currently recruiting to look at that issue. But there's a distinction between common symptoms that are diagnostic for MSA or suggestive of MSA, and other things that can happen because of MSA that may be more sporadic. So I think this is one that they're trying to determine how common this is.
Okay. There's a question for Dr. Braitsch. How can one exercise when they're in the wheelchair?
Oh, that's a great question. Yeah, there are so many ways to exercise. And I think the single most important concept that I've experienced when working with folks with MSA is safety matters so much more than effort. And I know that's easy to say, but I can't tell you how often I've run into folks who are eager to get a great workout, who maybe if they're doing a non-contact boxing training group with me, get really ambitious and want to throw that punch, even though they're in the chair, which is wonderful, but maybe lose sight of where the armrests are and can end up with a little bit of an injury, or maybe reach a little too far forward and tip the chair a bit. So I think, the environment is almost more important than the type of exercise in a lot of ways of thinking about it. So, first and foremost, as a martial artist, I love Tai Chi because it's slower, it's more gentle, and it's easy to modify for a variety of abilities. I've had folks who maybe spend a good portion of their day in a wheelchair, but still have the ability to stand for shorter bouts of time. And, if they're given support and some supervision, spending some time in standing, working on the footwork for Tai Chi is very approachable. But even sitting up tall and not just slumping back into the back of the chair can be a fantastic beginning for exercise for somebody with MSA who's in a chair. And from there, you can start working on some of the hand motions, trying to stay upright as you work through different techniques. People do a lot of great chair yoga classes along those lines, or chair aerobics. There are all kinds of ways, especially in today's day and age where we've got access to a variety of types of classes on Zoom or recorded exercise groups on YouTube. It's kind of like the sky's the limit. But the biggest issue I just run into, especially in the world of virtual exercise, is, let's imagine we're in a class together. I don't have the ability like I do in person to step forward and place a hand on your shoulder and make sure you stay safe. So I think the more somebody can focus on their own safety and their ability to, even if it's dialing back on some of the movements from a group or an exercise session, focus on simple things, staying up tall, big reach, trying to move the legs while they're seated. These are things that can make a big difference with minor adjustments.
Wow, so there's a lot of stuff you can do even if you're in the wheelchair, but support and supervision is necessary.
You said it better than I did. Thank you.
No, thank you, doctor. There's another question for you. Do you recommend any chair exercise videos on YouTube if there's no access to a PT or an OT?
Well, that is a great question. I think if there's no access to a PT or an OT, the type of exercise is probably more contingent on the needs of the person exercising. And I'll give you an example. I don't want to sound like I'm being excessively vague here, but if somebody's greatest area of opportunity is maybe they're working on finger motions, well, having them do a boxing workout probably wouldn't be as helpful as having them spend some time working on specific exercises for their hands. So I think when you think about exercise groups or videos, the hope there would be more that it's for overall fitness, to keep the circulation going through the body, to keep the lungs from building up a lot of fluid, to keep range of motion in the joints. But in this day and age, I feel like there's so many opportunities to have access to an OT or a PT, whether that be in person or home health or telehealth or at a clinic. There's so many different ways to do it that I wouldn't ever recommend a recorded class over those things. But that being said, I think for people who are trying to combat the broad spectrum of impairments that are available, really anything they can do consistently and safely is best. And I know that sounds, again, really vague, but I love Tai Chi. Not everybody does. That's my experience. There's some people who think that's more boring than watching paint dry or watching, golf. And again, there are people who love watching golf. I'm not one of them. But anymore, there's so many different ways to do a seated dance class or do a seated yoga class, or maybe with some support and with some supervision, do some of these things partway from standing and just isolate the footwork, or hang on to a support and just do one arm at a time. I think the bigger thing is finding something that the participant wants to do, and that way they can more effectively show up.
It's a great advice, doctor. There's one question for Dr. Ann. Is there a role for nursing and research for MSA research?
Absolutely. You're talking to a nurse researcher. So Yes, there's always a role for nursing when it comes to research in many aspects. In fact, one of the talks, another one of the talks that talks about multidisciplinary teams and creating MSA centers of excellence talks about the role for nurse practitioners. And there's roles, different roles on research for nurses could be about how to support the family. You know, you have to think of nursing. A lot of people don't understand the difference between the different levels of nursing. So, you know, registered nurses have a particular role to play. They tend to have a big role in dealing with families and like delivering medications and things of that nature. Nurse practitioners have more of a physician type of role in terms of providing supportive care. And in the other talk on MSA Centers of Excellence, the suggestion was that nurse practitioners serve as kind of the coordinator of care. And so there's a lot that could be learned about how, a lot of research that could be learned about how to optimize those roles, for example. And there's been research done in other rare health conditions, but I think it's always important to see how are patients with MSA unique? What are the needs that are unique to those patients? So there are many different areas where research, nursing research could come into play in how best to coordinate care, how best to serve in that kind of role, how best to interface with patients and their caregivers. Finding best practices on delivering medications when patients start to develop difficulty swallowing. A lot of that research might have been done for other disease states. And so you can always apply those kinds of research studies in the context of MSA. But, you know, given how rare MSA is and the lack of availability for services and just treating symptoms, there's a lot of work that can be done to find out how better to support families and make life transitions easier for patients. You know, when it comes to palliative and the hospice care, nurses play a big role in there too. So yeah, long answer longer is there's always a role for nursing research.
Thank you so much, Doctor. Another question is for Dr. Braitsch. I think I understand the importance of large amplitude movements to preserve range of motion in major joints of the body. But how can I do that if an activity like that makes me feel unstable or unsafe?
Well, that's a great question. Yeah, I know. We all know, or we wouldn't be here, that you know, MSA is not the same as Parkinson's disease by any stretch of the imagination. But we do know that large amplitude movements are one of the keys to success to maintaining range of motion, just like you mentioned. So when I say large amplitude, I mean, for example, we were talking about boxing earlier. In boxing, I tend to see with a lot of different types of movement disorders, including MSA, smaller, more rapid punches. And also, we know the value of intentional focus in trying to overcome or bypass some of these movement symptoms. And so we know a lot of times people with MSA can still take that intentional focus and really reach far out and pull back with a punch instead of those small, rapid ones. So even if you have to slow a motion down, large amplitude would be that big functional reaching motion that helps to preserve range of motion, keep the joints from tightening down, making it harder to reach. So how can you do that while still maintaining safety? There are so many ways. It's fantastic. And again, I'm so biased to the internal Chinese martial art of Tai Chi because it is slow moving and it is relaxing. And we can even try some right now. You could just sit up tall. If you're standing safely, you can stay standing, but you can take your hands here. You can kind of let them hang down in front of you, palms up. You can scoop up towards the chest, point the fingertips forward and press forward. And a lot of times my experience with folks with MSAs is they start, I'll give you a sideways view here, as they start pressing forward, it's so easy because of that postural instability to lean with it. And what we can do is we can try to really emphasize that upright spine. So scooping up, breathing in slowly, pointing and then breathing out the whole time you press forward. In doing this, what are you doing? Well, you could say from a Tai Chi perspective, you're gathering up chi, which is life force energy, and much harder to quantify or explain. It sounds a little crazy. But you could say, well, from a physical standpoint, what are we doing? Well, we're using muscles of postural control to stay upright. We're using muscles that control shoulder blades to keep those scapulae, the shoulder blades, back and down, which really helps with getting rid of tightness in the chest. We're using the biceps to bring the wrists up. We're pointing and pressing forward, getting some great motion through the wrists, elbows, and shoulders. And all of that's in a pretty safe range of motion. So that's something where in Tai Chi, oddly enough, slower is better. But one reason that's really helpful for folks dealing with MSA is it requires a lot of intentional focus to move more slowly. And that also then makes it easier to recruit muscles for those movements and to improve the proprioceptive input to the brain, that awareness of where is my body in space? Am I leaning? Am I slouched over or not? So I think there are a lot of ways of doing this, and I'm so biased, and I feel like I'm a little bit of a windbag here just going on about this stuff. But something like Tai Chi or postures in yoga, where you're doing those great warrior stances, pushing the chest out, squeezing the shoulder blades back, and really reaching out far, they can go so far in preventing tightness and keeping those joint surfaces lubricated and working well, which makes it easier to keep moving. So that's
and I'm sorry to interrupt, but I can even see how those things would be beneficial even for patients with more advanced disease. Like my mother, just anecdotally, what I'm about to say is very anecdotal. So my mother has been living with MSA for about 8 years now. And who knows really when her first symptoms really started, but she was diagnosed 8 years ago. So she's fairly advanced right now. And she has a lot of difficulty speaking, swallowing, all that's getting to be really difficult. When she speaks, she mumbles a lot. She is barely a whisper sometimes. But they have a music therapist come in on Fridays to her nursing facility. And it's amazing to see her. My mother's Irish by ethnicity, and they have this woman come in and she sings Irish songs with my mother. And then you can hear, like, she sings along. You can understand her. She's got the power behind it. And so they do have strengths there that they can tap into that they probably aren't even aware of. And these kinds of movements that you're talking about, not only do I feel like she could probably do those things, and it might, even if it can't help her at this point, it's something that she might feel some sense of ability, because right now she just feels like she's at the point where she really can't do much for herself. My sister goes over and feeds her because she really can't even feed herself anymore. But that's something she could feel a sense of accomplishment, something that she's doing, and frankly, to distract her, because she's pretty much just, sitting there by herself the majority of the day. So I think there are a lot of benefits to just kind of trying to do intentional activities.
You're so right. I mean, I don't want to interrupt if you have more to say there too.
No, yeah.
But I think in addition to the physical benefits that can come from moving, some of these movements aren't going to do enough to undo what's been done with MSA, right? But you could say, in the present moment, which is all that really matters for anybody at any given time right now, what are those movements doing? Well, they can help with some pain relief. We know that. We know that they can help with reducing some of the stiffness and aches of the body. But even with any type of mindfulness-based exercise, that slow, intentional diaphragmatic breathing, that deep belly breathing, does so much to rid the body of cortisol, stress hormones, and give somebody a better overall sense of well-being right now. So, for somebody like me, I got into martial arts because I'm probably somebody who needed meditation from a very early age, but have almost never been able to sit still very well. For me, it's a form of action meditation. And that's the case for a lot of people where, not only are you trying to get in tune with the movement and feeling a sense of accomplishment of, all right, I'm learning something new, or I'm trying something that's difficult but realistic. But then also it can become a form of meditation where you can kind of get lost in the motion instead of having the brain wander off into the future or into the past. With Tai Chi, if your brain has wandered because you probably lost track of the movement, and that's an immediate cue to come right back to right now. And that can be really freeing and relaxing, in addition to having all these health benefits. So,
and this goes back to the question you asked earlier about nursing research. These kinds of collaborative studies, you could look at what kinds of benefits patients get out of doing these types of exercise at different stages of disease. Because we're kind of speculating, let's be honest. I mean, at least I am, in terms of where my mother is at an advanced stage of disease. But that's something that could certainly, you could research, and you could try to determine, what kinds of benefits can people obtain from doing these types of activities. And so.
Yes, that was a great explanation by Dr. Braitsch and Dr. Bagchi. And the key takeaway over here is intentional focus, whether it's on your exercise, whether it's on your breathing. Intentional focus is very important. Next question is for Dr. Ann Bagchi. What can we do to educate nurses about MSA and other health professionals? What can we do to educate nurses and other health professionals about MSA?
So one of the things I'm happy to say, I wrote, based on the presentation that was given, I had drafted an article for the Journal for Nurse Practitioners last year, and it was published in the journal. And so it was one of the first journal articles for nurses, directed towards nurses relating to MSA. And the journal editors actually chose the article as one of their continuing education offerings through the American Nurse Practitioner Association. So, and last time I checked, there had been more than 60 views of that article. And so, that's just one way. It's important, as a nursing researcher, I haven't yet gotten involved in any specific nursing related studies on MSA, but that's certainly one way to improve awareness, trying to get the continuing education out, and just doing things like supporting organizations that are targeting MSA, like the Defeat MSA Alliance, and getting information out through social media. I mean, these are all things nurses, are people, and they are accessing social media. So there are those things as well. But a lot of people who are aware of MSA is usually because they know someone who's been diagnosed, and we need to get beyond that, definitely. So yeah, more research, more presentations at conferences.
Okay. So it's going to be something that you actively have to be involved to educate yourself more about rare diseases.
Well, that's certainly one way. Yeah. I mean, there has to be a sense of curiosity, but there's just so many rare diseases. If you go on to the federal government's rare disease site, there are hundreds. So you can't kind of wait for people to decide that they want to look into rare diseases. That's why you have to be, those of us who are in the field have to be very intentional about increasing awareness in our professions.
There's another question. What is the link between POTS and MSA, or is there one?
There definitely are links. I don't think, I'm the right person to address that in any kind of detail. But
there's another question for Dr. Mike. Thanks for doing this. What's the optimal balance between exercise and subsequent pain? Days I overdo things are often followed by multiple days of heavy cement-like legs and pain. No pain, no gain. How do we balance activity with maintaining strength? Do we understand how overuse impacts MSA?
Those are very important and exciting questions for me to talk about, and not so exciting for you to experience. I'm sorry to hear somebody's experienced that out there. Yeah, the mindset with exercise is often no pain, no gain, right? And that might be true for somebody that's hitting the gym, trying to bulk up for some sort of athletic competition. My experience for patients with a chronic or progressive condition, though, is pain is often an indicator that should be listened to. And so it's a little tricky. The question becomes, what kind of pain are we talking about? If the pain is, gosh, I really haven't moved in a long time, and now those same muscle groups I was using maybe earlier today during an exercise session, or maybe even that I used yesterday in an exercise session, those are really sore and achy, that's okay, because that's very common, or that's most likely a common symptom of exercise, which is just muscle soreness, which often is an indicator that you're using muscles that haven't been used in a while. A lot of times that can be caused by buildup of lactic acid. How do you know that that was the case? Well, you start moving those muscles again, you get the same type of pain or soreness that you felt before. If you're getting pains, though, that feel sharp and stabbing, or stinging, or burning, those can be indicative of other types of pain. And so I think when you mentioned the one that was in that question of the heavy cement, yeah, that to me is a clear-cut sign of doing too much the day before. So how can you gauge things? Because every day is different for everyone in life, but every day is certainly different for somebody with MSA in terms of even the spectrum of symptoms they're experiencing, because how was your sleep affected, and what's your stress level like? But during your exercise sessions, I think the single best thing you can do is try to use some sort of intensity spectrum. And I like to use a 0 to 10 one. There's a famous one out there called a Borg rating of perceived exertion scale, which goes from something like 12 to 22. I like to use a 0 to 10 scale because it's just easier to conceptualize. If 0 out of 10 is like, I just woke up from a nap, I'm not doing much of anything. And if 10 out of 10 is like my maximum effort that I cannot maintain, like I'm running from the police, or I'm running after somebody that stole something, an effort level that I cannot possibly maintain. A lot of the research for exercise with a variety of movement disorders supports moderate intensity and high intensity. And for people with MSA, we know that risk of overdoing it is so much greater the day after, and even a couple days after, than it would be for somebody with a different movement disorder from MSA. So I say all that to say, during your workouts, if you can kind of gauge and periodically check in with yourself to say, if 0 is doing nothing and 10 is maximum effort, hopefully I'm somewhere between a 4 out of 10 intensity and maybe a 6 out of 10 intensity. That can help me to minimize the impact of what you're talking about, that heavy cement legs the next day. And also, if you're feeling that, you might still try some of those same exercises, but the day after your workout, but on a much lower scale. So if you're feeling heavy cement legs, the general idea would be get what movement you can out of those legs to get the blood flowing and to get the brain oxygenated so it's more excitable and working on a little bit higher level, but not so much that you feel like, gosh, this is going to be a repeat of this morning's heavy cement legs performance. So it's kind of like the old adage of the tortoise and the hare, and the tortoise won the race. And I think that same low impact and intensity to moderate level of intensity is so critical, because if for anybody, over time, the body can adjust to whatever degree it can to consistent forces you put it under and consistent stresses that you put it under. But my experience with patients with MSA is if they overdo, the consequences are much greater the day after. There's a lot greater risk of falls. There's a lot greater risk of instability with motions, or even with hanging on to things, it can be harder. So while we know exercise is medicine, it's almost like overdosing on that medicine if you overdo it. So stay in the middle. I hope that's helpful.
Okay, that's
I want to go
great.
back to that question about POTS. One thing I do want to point out, I don't have any particular expertise on POTS specifically, but one thing to understand about the difference between regular orthostatic hypotension and what you see in MSA, with POTS, there's an associated tachycardia. So basically that's a compensatory approach that the body's trying to take, right? What happens when you have orthostatic hypotension is that when you suddenly stand up, you get displacement of blood to the lower limbs. And in a normal, healthy person, there are compensatory mechanisms such as increased heart rate and things like that. The thing with MSA is that those mechanisms are not functioning. And that's the main distinction. And that's the big problem. That's why neurogenic orthostatic hypotension is a defining feature of MSA, because you don't have those kinds of compensatory mechanisms. So that is the one thing I wanted to clarify about that. But in terms of POTS as a condition itself, I have no expertise in that specifically. But
thank you, doctor. There's another question. My partner has been diagnosed with MSAC. He has had symptoms for 2 years, including ataxia, ED, and REM sleep disorder. His MRI showed the hot cross bun formation, and the skin test was positive for the protein. I'm trying to find info on disease progression and can't really find anything. Are there any resources on what to expect next? Dr. Ann, would you like to take that?
I'm sorry, can you repeat the second? I was
yeah, sure.
By some of the comments in the chat.
Yes. My partner has been diagnosed with MSAC. He has had symptoms for 2 years, including ataxia, ED, and REM sleep disorder. His MRI showed the hot cross bun formation, and the skin test was positive for the protein. I'm trying to find information on disease progression and can't really find anything. Are there any resources on what to expect next? So they just want to know what's going to be the next stage of progression of this disease.
Yeah, these kinds of questions are hard to answer because it can be very individualized.
Yes.
Some patients progress very rapidly. I don't know if the patient in question has a multidisciplinary team or who's caring for them, if there is a neurologist heavily involved. So trying to kind of predict what's going to happen next. There's so many manifestations of the disease. It really takes, there's no specific course necessarily. There are certain things that you can kind of expect down the road things that I've kind of described in terms of what my mother's experiencing, difficulty breathing, difficulty swallowing, things of that nature. But in terms of like when it might happen, the range of life expectancy can be fairly broad. I mean, I think the average life expectancy is like 9.8 years or something in that line. But some people progress very rapidly, and so it can be hard to kind of say specifically. That's why it's important to get a multidisciplinary team who can help deal with the symptoms that the patient's experiencing right now. But there may be other aspects of the patient's current state that might suggest where problems might be kind of in their early phases. And you may be able to identify and kind of say that, okay, this might become a problem more early for this patient as opposed to another patient.
Okay.
But the best resources is a multidisciplinary team, I would say.
Yes. There's another question for Dr. Anne. Do you find people with MSA who can withstand lower pressures? So I guess they're talking about lower blood pressures.
I'm not sure I understand the question.
I guess, so maybe I guess this is a question about diet and low blood pressure. What would you recommend as a diet for MSA?
So
if they're experiencing low blood pressures?
Well, low blood pressure, one of the most important things is hydration.
Okay.
Keeping patients hydrated, because that keeps the blood volume higher. So that's one of the most important things. There's another talk, I think it was in the clinic, it's in the clinical group of talks that talks specifically about orthostatic hypotension. And, that's one of the key recommendations. There are some drugs that will treat it. The problem is there are only 2 drugs that are currently FDA approved specifically for MSA to treat that. There are some other ones that are used, as we say, off label. But in terms of when it comes to diet and pressure, the best thing you can do is keep patients well hydrated.
Okay. So hydration is important.
Yeah, absolutely. Absolutely. And there are other things as well. There are binders you can use. They don't really recommend compression stockings, for example. Preferably you want a higher compression that goes up to the waist. And
okay.
So just using the leg stockings themselves are not very helpful. Unfortunately, one of the problems is that it becomes really difficult to put those on. So they tend not to be helpful for a long-term use. So.
Okay. There's another question for Dr. Mike. How long and how many times a day we should exercise? I'm a patient diagnosed with MSA/C, dependent on walker assistance, and being followed for 1 hour a day in physical therapy 5 days a week.
Well, first of all, doing an hour of physical therapy a day, 5 days a week is fantastic work. So keep that up if you can. Coming up with definitive recommendations overall is a little tricky. And it's tricky because, kind of like we were talking about earlier, every day is different for people. And that's even more true with MSA. And I know, I'm talking about it from observational standpoint. A lot of folks who are watching this have lived that. And so hopefully you get that. What you could say is, all right, well, are there guidelines overall for anybody? And you could say, okay, well, for healthy aging overall, the World Health Organization and the CDC recommend 300 minutes of physical activity each week for people to age well. And you could say, okay, well, if you're doing an hour of physical therapy a day, 5 days a week, you certainly have that covered. because there's 60 minutes in an hour, 5 hours out of the week. That's 300 minutes right there. You could say that should probably be spent, though, on a variety of different tasks. Some of it should be, if you're still ambulatory with a walker, like the person who wrote the question mentioned, probably half of that, if you could swing it, could be spent with walking or some sort of weight-bearing exercise. So that's like 150 minutes a week. And that kind of matches guidelines that have come out for people with other movement disorders like Parkinson's disease, for example, to slow the progression of symptoms. But in reality, what matters? In reality, it's kind of like, well, whatever amount of movement you can do consistently is a very big deal. And my hope for people with MSA is that they get less focused on the number of minutes and the amount of time, and more focused on directing their effort where it's most useful. And I'll give you some examples. A patient I worked with in the past who became a very dear friend, his greatest challenge was trying to work on his balance. And he got hooked up with the right walker. It was one of those nice reverse Nimbo walkers, because he had a lot of trouble with his posture and he had a lot of ataxia with his movement. So that wrap around from behind walker gave him the ability to be more upright and to take better steps. But still with it, he was getting a lot of work just going forward. So what could he do with his time to be a little bit more useful when it comes to balance and control? Well, he could strengthen the hips going out to the sides. He could strengthen the calf muscles, the plantar flexors, to make his walking more efficient. He could strengthen hip extensors, glutes, muscles of the hip that help to push the hips forward as you stand up. And those were all things that were helpful from a strength perspective, in addition to his walking. I had another friend with MSA who, over the years, his bigger issue and use of his time was trying to find ways to prevent tightness from taking over and creating some contractures in his hands and in his arms. And so for him, some amount of overall aerobics was helpful, because if there's some portion of that that's dystonia related, well, it's thought that, and it's shown in other movement disorders, but it's hard to find really a lot of good research for MSA specifically. But it's thought that aerobics, getting the heart rate up, help the brain to be more excitable, delivers more oxygen, more blood flow, more nutrition to the brain, which makes things like dystonia a little bit more manageable. And so if that's the case, some of that stiffness can be kind of washed away to a small degree by aerobic exercise. And after that, things like those large amplitude movements that we were working on earlier, things like stretching in the forearms and in the hands, become much more effective than if you just did them with cold muscles. So, to somebody that's doing an hour a day, awesome. My biggest advice would be give yourself permission to, if you have a day where you feel like you can't quite do an hour, be okay with that. But more, I think exercise can be kind of a celebration of what you can accomplish on a given day. And I think if that mindset is followed, people with and without MSA will do a lot better, honestly.
It's important to be consistent with your exercise routine.
Yes.
You have a good way of summarizing.
Oh, thank you, Dr. Ann.
I just noticed that one of the questions in the chat is, what does Dr. Bagchi mean by neurogenic defining
orthostatic hypertension?
Yeah, so there are, under the new Movement Disorder Society definition for diagnostic criteria, I should say, this neurogenic orthostatic hypotension is one of the core clinical features. And so a patient could have either urinary dysfunction with post-void urinary residual volume, meaning that after you've urinated, there's still urine within the bladder. So that could be one thing. urinary urge incontinence, or neurogenic or orthostatic hypotension. Either one of those three could be present. That, along with inadequate response to levodopa or cerebellar syndrome, are core clinical features of MSA. So I don't know what the specific percentage is, but a large percentage of patients with MSA do have neurogenic orthostatic hypotension. So that could be one of the core clinical features for clinically established diagnosis. So that's what I meant, when I was talking about that earlier. If I said hyper, I meant hypo, in case I said hypo. Yeah, I meant hypo.
Neurogenic hypotension. Yes. There's another question. It's either for Dr. Ann or Dr. Mike. I have all the team members, but I don't have a team as they don't communicate. Question would be, how can I facilitate that as the patient? Any tips or any ideas?
It's important to have one member of the team who's kind of the main contact, like one person to organize the team. This is the whole idea of managed care, actually. The idea that you have a primary care clinician who coordinates the rest of your care. And so I don't know, it's hard to say based on the question what's going on with the situation. Sometimes what happens is you have so many different experts or so many different types of clinicians involved that no one person is kind of stepping up to take the lead, and that can lead to communication breakdowns. And it's really hard for the patient and or their caregivers to serve in that kind of role. A lot of times you need someone with a little more clinical expertise to serve in that kind of capacity. So if you don't already have like one member of the team that you feel more comfortable with, that you feel like could take that kind of role, that would certainly be a good start. And like I said, with the other talk in one of the other sessions, they actually suggest nurse practitioners as that kind of role, because nurse practitioners have a good sense of what nurses do, because they are registered nurses first, right? But they also have a stronger idea of what some of the clinical specialties do, what some of the medications. So not everybody has access to a nurse practitioner. Not everybody maybe feels comfortable with a nurse practitioner, but when there are communication breakdowns, that usually means there's not one person kind of taking on that particular role. So that might be a good place to start, at least.
Okay, yes. There's another question for you, Dr. Ann. Is transcranial magnetic therapy useful in MSA?
I'm not aware of any randomized studies or anything that have shown that. I know there are a lot of treatments out there that anecdotally people will say have been helpful. It's kind of, where we are, you have to think about where we are with MSA is similar to where we are with other types of naturalistic therapies. They just haven't been studied, or they haven't been studied in patients with MSA. And so these kinds of questions, like, does this work for these patients? Like, that's a good basis for a study. So I'm not aware of research that has shown that to be the case, but that doesn't mean that it's not.
Okay. There is another question for you. Does it make sense to adopt a high protein diet for MSA patient?
That again, I don't know that we have definitive evidence for that. One of the other, I think that was in one of the clinical sessions. They do talk about whether protein can help with some of the other dietary issues that come about with MSA, but I don't know is the short answer. I don't know kind of what the role is for protein with MSA.
Both our doctors have been so amazing, and we are in our last 10 minutes of our Q&A. So if there are any questions for Dr. Ann Bagchi and for Dr. Mike, please go ahead, because our Q&A is going to end in next 10 minutes.
Actually, Kranti, there's a question for you that asked how.
Yes. I'm going to take that question. That's going to be the last question. There's a question for Dr. Mike. what do you think about boxing? Some people with PD do boxing. How about boxing for people with MSA?
Yeah, that's a great question. I've run non-contact boxing groups for people with a variety of movement disorders for the last 7 years now. And some of the folks that have joined us have been people with MSA. And I'd say, first and foremost, safety is number one. So hopefully whoever's running the group has some experience in helping people with MSA and understands that it is different from Parkinson's disease, because the way you create a safe environment can be quite different too. I think probably the most simple things to keep in mind there would be, if you use a wheelchair a lot and you don't have somebody to put a gait belt on you and stay with you to keep you upright, stay in the chair. You can still box from a chair. You can still work on upright posture and big functional reaching. Make sure though that, like we talked about earlier, you don't overdo it. And it gets so easy in a boxing class to overdo it because people are, they're really hitting stuff hard. They're moving faster. So I recommend that people try to stay at or below a 5 out of 10 intensity. They've got MSA and they're in a boxing class. Another thing that I found that is really helpful is offering some central stability to make it easier to move distally. So by that, I mean, I've had some folks with MSA in the past who have appreciated support, but hanging onto a railing wasn't very helpful. Instead, having something that they could lean into for support, like those adjustable height punching bags that have water or sand in the base, and have somebody stand behind them to help steady those hips and make sure they stay upright. That made it a lot easier to have good success with reaching the target. Other times when you're not as stable centrally, it gets easy to kind of miss the target, and that can be incredibly frustrating for somebody. So those are just a few quick points, but if I can be helpful in other ways, feel free to reach out.
Yes, sure. There's another question either for Dr. Bagchi or Dr. Mike. How about hyperbaric chamber?
That again, I can't speak to that. I saw in the chat that there was a statement that some people anecdotally have found that helpful. That's
Yes.
another one. I just don't know what the research has shown about that. Certainly what I've seen in terms of other presentations for this conference, that hasn't really come up, but again, that might be an avenue for future research.
There was one more question for you, Dr. Ann. Would you recommend any specific diet for MSA patients?
That's not my area of expertise, so I'm not aware of any specific dietary recommendations. I mean, all I can say kind of anecdotally is I've seen with my mother, like as she's gotten had more difficulty swallowing, it's just really important to stay on top of what patients can tolerate in terms of diet. Because one of the leading causes of death of people with MSA is pneumonia, because they're not swallowing correctly, and things can go into the lungs and cause pneumonia. So, as it does get harder for them to eat, you have to keep up their calorie intake as best you can. But, I'm not a nutritionist, I'm not a dietitian, so.
There's another question for you. Is there a link between mitochondrial dysfunction and MSA?
Yeah, I don't know about that.
Okay. There's a question about a person who's curious if there's what are the diagnosis hurdles for a young onset patient, and how can they find support?
Yeah, I think this is a big problem. I know there have been some people who've reached out through Defeat MSA Alliance who suspect they may have MSA, but one of the problems that a lot of patients face when they're under 50, let's say, particularly in the 30s, there have been no definitive diagnosed cases in people that young, but we don't have good specific diagnostic criteria. If you listen to Dr. George's presentation, he talks about updates on where we are with developing more definitive diagnoses and differential diagnoses tools. But that's probably the biggest problem that younger people are going to face, is that people might just say, well, you're too young for it, you know, and it may be that there are other problems going on, but basically you need to find a good multidisciplinary team that will, you know, rule out other differential diagnoses. Just being believed is probably going to be one of the highest barriers that people are going to face.
Okay. So there's this last question. It's for me. Based on your lecture, how can you stay positive when you're continuing to deteriorate without much improvement in a disease like MSA? That's an amazing question. And when we talk about positivity, we don't want to be indulging ourselves in toxic positivity. We don't want to deny our situation. So it's extremely important to validate your emotions. If you don't feel good about your disease, if you don't feel good about deteriorating, it's essential to be true to your emotions. You don't have to suppress your emotions. It's important for you to be true to them. But ask yourself, do you want to be happy? Do you want to feel positive? Are there things in your life that are good, that are going good? Are there any reasons for you to be happy? Is it going to benefit you if you're going to adapt to mechanism that is more constructive? Dr. Bagchi and Dr. Mike have spoken a lot about exercises and diet. So when you start thinking positive, when you start thinking about improving your current situation, you're going to be motivated to take action. And when you take consistent action over time, you are going to see results. You're going to see that maybe you can do things which previously you were kind of losing. You're going to retain your mobility. So yes, it's difficult to be positive, but with the correct professional help, with a very strong support system, you can definitely be more balanced in your thought process, and it will definitely help you.
You know, one
Thank
thing
you so much.
that I've
Yes,
with
Doctor.
others, your support people can be very important. As she's declined, she doesn't want to see like new visitors, so she's really restrictive in who she wants to see. And so, you know, whenever we try to see her, we try to make the best of the time that we're with her. So like I said, she enjoys singing Irish songs, and that gives her a lot of happiness. I was showing her some so if nobody's seen the Carol Burnett show and the Siamese elephants routine with Tim Conway, I showed that to my mother and she was laughing uproariously. So, you know, it is hard because right now there's not much she can do for herself. So she pretty much sits in her wheelchair most of the day. So to be able to bring things like that to her, resources to her, and see her laugh and smile, you know, it means a lot to her. It makes a big difference. And of course, spirituality and religion can be very comforting to people and help as well.
Even spirituality plays a very big role in the healing journey.
What I can tell you too from experience with patients, I've seen plenty who understandably have let hard things get them down. And some of the most incredible people that I've met have taken it on as almost their role to see, you know what, despite this, I'm going to see if I can get people to laugh or smile. And it blows me away what people are capable of. So I love that you mentioned, you know, is there any benefit to focusing on the negative? Is there any joy you can find despite your present circumstance? And, you know, what do you want to do about it? It just, I'm just brought to tears thinking about this one guy who made it his life's calling to spread joy despite MSA. So
that's amazing.
It's possible.
Yes. Thank you so much, Dr. Mike Braitsch and Dr. Ann Bagchi. Your talk was very informative, and you both have addressed all the questions in the best way possible. Thank you so much. I also thank Defeat MSA Alliance for this free, informative conference.
All right, thank you.
Thank you so much.
Thank you. Take care.
Take care.